Welcome. Let's take a look at our top story this hour. A top German virologist has declared that the pandemic phase of COVID is over. This has led to German politicians calling for an end to all pandemic measures. But what does this really mean? Why do virologists feel that the pandemic phase may be ending? Let's look at the situation in Germany. Health authorities are still reporting more than 100,000 new COVID infections per week on average. But they are also saying that severe infections are more rare than during previous COVID waves. They credit this to viral immunity built up by a large proportion of the population. On Tuesday, the head virology at Berlin's Charité Clinic, Christian Drosten, said, and we quote, "We are seeing the first endemic wave of COVID-19 this winter, so in my estimation, that's the end of the pandemic," unquote. Now, Drosten, who sits on the German government's Pandemic Advisory Council, also said that an outbreak in the summer is highly unlikely. He said this is because immunity to COVID will be broad and resilient after this winter. Now, what exactly is a pandemic and what does endemic mean? Well, a pandemic spreads around the world, but we say a disease is endemic to a place when it stops spreading across multiple regions unchecked. Therefore, the rate of spread becomes predictable. Thus, the degree to which a disease spreads is a simple way to differentiate between them.
We are now indeed entering what we call endemicity. That means we are now moving from a pandemic to an endemic state. And the definition of this is that the reproductive numbers, the R0 that we've always talked about, is now around 1 or sometimes below 1. Maybe if there's a little bit of a cluster, then it can go above 1, but it's now more in a steady state than we've ever seen it before.
The severity of COVID has also stopped raising alarms. Deaths caused by the disease have gone down around the world. This, of course, excludes China, which is expected to see over 1 million deaths in the next few months after the country hastily rescinded its zero COVID policy. But in countries such as Germany, where the population has developed an immunity to the virus, the calls to do away with COVID measures continue to gain momentum. Which brings us to the next question. Should COVID be normalized? Should it be treated like the flu? A study from Japan shows that people infected with COVID have a higher risk of developing heart or vein disorders. They were examining people infected during the 4th and 5th COVID waves in the country. Those infected also showed a higher risk of developing diabetes. But this was before Omicron became the dominant COVID variant. The research team says there is little difference between infected and uninfected people after Omicron had emerged. So if Omicron remains the dominant variant, that could lower the risks associated with getting rid of pandemic measures. And to further aid immunity, new vaccines and booster shots are still being developed. The early vaccines were emergency measures aimed at containing a relatively unknown disease. Newer ones can specifically stem the spread of Omicron and its subvariants.
What we really need is a next generation vaccine that will reduce the infection of COVID-19 so that we don't get ill at all. They're probably a year or two away, I would expect. I think by that point, we can probably say that we will have massively reduced COVID-19 as a threat. It will always be with us, and we do need to keep an eye on it because we know that it is a dangerous virus. I think we are going towards a better place.
While calls to rescind COVID measures continue to increase in Germany, some doctors still urge caution. They still say prevention is better than cure after all. WION, now available in your country. Download the app now. Get all the news on the move.